We'd like to welcome so many of you just coming into our webinar chat room. We thank you for joining us tonight for this virtual UMiami Health Talk. Why is my voice hoarse and what can I do about it? I'm health journalist Ileana Bravo. I will be your moderator for this evening's talk presented by UHealth's ear, nose, and throat experts. Ranked number 44th in the nation by U.S. News and World Report, our ENT specialists are highly experienced in treating a wide variety of conditions that affect your ear, nose, or throat. Conditions that can impact your quality of life. Our experts have the knowledge and skills to accurately diagnose and effectively treat them. We invite you to learn more about things that affect your ears, nose, or throat and the impact they can have on your quality of life by visiting www.umiamihealth.org/ENT. Also, to make an appointment with one of our experts, here's your number, 305-243-3564. We're going to have those numbers and the contact information up at the end of this as well. So hang in there with us if you want to contact our experts. Well, each year in the month of May, Better Hearing and Speech Month provides an opportunity to raise awareness about communication disorders. So tonight we're privileged to hear from two University of Miami Health System voice experts, Dr. David Rosow, Associate Professor of Otolaryngology, and Dr. Adam Lloyd, Assistant Professor in the Department of Otolaryngology, Division of Speech Pathology. And as a reminder to you, we're going to have a question and answer session at the end of the presentation to answer the questions that so many of you have submitted in advance. But don't worry, if you didn't already, you can still ask questions by using the anonymous Q&A feature at the bottom of your Zoom screen. Take a moment to locate that because you can enter your questions as you think of them. We'll prepare them for Dr. Rosow and Professor Lloyd to address at the end of the presentation. So now it's my pleasure to introduce our panel, Dr. Adam Lloyd, as we said, and Dr. David Rosow. Dr. Lloyd is an assistant professor in the University of Miami's Department of Otolaryngology in the Division of Speech Pathology, where he specializes in voice care. Dr. Lloyd began his career as a classical singer and vocal pedagogue prior to becoming a voice pathologist. He specializes in singing voice rehabilitation as well as gender-affirming voice care. Dr. Lloyd teaches courses on voice disorders at the University of Miami and Nova Southeastern University and is an active researcher in the field of voice with interest in outcomes of voice therapy and vocal pedagogy, prevalence of voice disorders, and vocal health. And joining him tonight is Dr. David Rosow, a board-certified otolaryngologist, head and neck surgeon, and fellowship-trained laryngologist. Dr. Rosow is an associate professor of otolaryngology at the University of Miami Miller School of Medicine and is director of the Division of Laryngology and Voice. He's also an assistant professor of clinical vocal performance at the University of Miami Frost School of Music. We're going to begin with Dr. Lloyd. So Dr. Lloyd, you have the floor.
Good evening, everyone, and thank you so much for that introduction. This is a topic that Dr. Rosow and I live every day with our patients clinically, and it's a privilege to work with people who have voice problems. I myself actually have a voice problem at this moment in time because I am just recovering from a cold. So I do have some laryngitis. So you get some firsthand knowledge and as I explain what's going on with my own voice. So how does the voice work in general? So first, we start with our power supply, and that is our lungs. Our lungs then send the pressure up to the vocal folds, which sends them into vibration, as you can see there on the screen. And then after that, that's not really much of a sound. It's all it is sounds kind of like ah. And then our articulators, our throat, bounces the sound around, and the articulators, they shape the sound into consonants and vowels, and that's how we are understood. Right, so there's three major systems that allow us to produce our voice and be understood. Next slide. So one of the first things that we encounter when we see a patient is how they sound using our ears. Right? We first talk to them, get to know them, what's going on with the voice. And at the same time, we're understanding from their perspective what's going on with their voice and the symptoms that they're experiencing. We're also listening to the quality of the voice. And the voice, the quality can tell us a lot. Go ahead to the next slide. So there are a lot of different terms that we can assign to how someone sounds. Someone can sound a little raspy, kind of like how I think I sound right now, a little rough. People can sound like they're straining, like there's a lot of effort in their voice. There can be a weak or a breathy quality to the voice. There can be tremors or like a vocal catch. And all of these things can be related to what's going on with the anatomy. So it kind of gives us an idea before we actually do the physical exam, what we're going to see and how we're going to help this person in treatment. You can go to the next slide. We're going to play now 3 examples of different vocal qualities that are pretty different. And I'm going to describe what it is that we're primarily hearing in these voices. Let's listen to the first one.
We were away a year ago. The blue spot is on the key again. How hard did he hit him? We eat eggs every Easter. My mama makes lemon jam. Peter will keep at the peak.
You might say, what are these silly sentences that she's saying? And these are sentences that from the consensus auditory perceptual evaluation of voice, which is a fancy term for something that we use to quantify what we're hearing. And so I would describe this voice as primarily a raspy quality to the voice, sort of an irregular quality in the voice. Let's go to the next one and see how this sounds different.
The blue spot is on the key again. How hard did he hit him? We were away a year ago. We eat eggs every Easter. My mama makes lemon muffins. Peter will keep at the peak.
When I listen to this voice, the thing I hear the most is a weak and breathy quality. And let's listen to the last example.
Key again. How hard did he hit him? We were away a year ago. We eat eggs every Easter. My mama makes lemon muffins. Peter will keep at the peak.
I feel a little tight in my throat just listening to this person speak. So primarily what I'm hearing in this person's voice is what we call strain. And what's interesting about all 3 of these examples is that all of these patients may come in saying that their voice is hoarse. So hoarseness is really more of an umbrella term that we use to describe sort of a voice problem. So now let's look a little bit deeper into what else we do in order to evaluate the voice. So we can look at what I call like the digital footprint of the voice, which is the sound, measuring the sound of the voice. And we can do that by what's called acoustic analysis. You can see on the upper left-hand corner, there's a sound, a spectrogram and an audio wave form. And by looking at this, we can tell how smooth the voice is and how loud the voice is. And if we zoom in on things, we can actually tell what the pitch is and the harmonics above that pitch. When a person's voice is very hoarse, then it looks a little bit more irregular in its lines. On the upper right-hand side, you can see a graph that represents different acoustic values. The green is actually what's considered to be normal, and anything outside of that green is abnormal, and that is the patient's value. So this gives us a nice idea of what kind of acoustic values are out of the normal range. On the left hand side on the bottom, you'll see what's called a voice range profile. And this is a really interesting way of evaluating the voice because it gives us an image of how the patient is able to produce pitch and loudness throughout their entire range. So it gives us an idea if there's any holes in the range. It also gives us something to compare to pre and post when we're doing treatment for them. And finally, the picture on the right-hand side is what's called a phonatory aerodynamic system. It's how we measure airflow and how it interacts with the vocal folds. Now to Dr. Rosow.
Thank you, Dr. Lloyd, and thank you all for joining us tonight. So my role at this point will be to talk a little bit about how we evaluate someone who's hoarse and how we diagnose different kinds of voice problems. So Dr. Lloyd mentioned some of the different ways that we have of looking at the acoustic profile of a voice. Part of my role is looking at the voice itself and looking at the vocal cords and figuring out where the problem lies. We have different ways of doing that. If you've ever been to an ENT's office, you may have previously had somebody put a scope up your nose, but we can also look through the mouth. You can see that I'm holding a rigid scope here that's going through the mouth of this patient and with a microphone that's held to the neck. And this process is what we call stroboscopy. And it's called that because we're using a specialized strobe light to visualize the vocal cords as they vibrate in slow motion. And this can be done with this camera that goes through the mouth. We can also use the traditional camera passed through the nose this way. And what this looks like is a close-up view of this. So we can see the vocal folds vibrate, slow motion, how they come together. We see how well they vibrate. We're able to look and see if there are any growths or areas of redness. I should point out that your vocal folds are really quite small. They're only about 1 centimeter to 1.5 centimeters or less than half of an inch in size. They fit on the size of a penny. And so we're looking for areas of growths or redness that may be as small as 1 millimeter in size, about the size of the head of a pin. We want to see how well the vocal folds close. Do they come together completely, or are there gaps? Are they soft and pliable? Are they well lubricated? Do we see a lot of excess mucus, for example? I know a lot of people come to me complaining of phlegm, and that certainly is something that we're able to see on this exam. So using stroboscopy, we can often diagnose a whole litany of benign voice problems, which I've listed here: acute and chronic laryngitis, muscle strain, nodules, which if you are a singer or no singers, you may have heard of, a hemorrhage or a bleed in the vocal fold, and then finally vocal fold paralysis. So acute laryngitis is pretty much what Dr. Lloyd is going through right now. You can see an example of this right here. You can hear that strain in the voice. The vocal vibrate as well. This is usually something that happens rapidly, usually because of a viral infection, and lasts anywhere from 3 to 7 days. So if you've ever had a cold and lost your voice, this most likely is what you're experiencing. It occasionally can be caused by a bacterial infection as well. And the inflammation and the stiffness from that infection makes the vocal folds vibrate poorly. The good news is this is usually treatable with simple voice rest and hydration. Chronic laryngitis can happen for a number of reasons. And you can see here that the vocal folds are now very inflamed and irritated in appearance. And this is very commonly seen in folks who have reflux. And reflux has many symptoms which may be known to you, such as a sensation of something stuck in your throat, a feeling of heartburn, hoarseness that's worse in the morning, perhaps some difficulty swallowing or a feeling like there's a lump when you swallow, coughing at night, or throat clearing. All of these things could be an indication of reflux and the inflammation that it causes. Some people who have reflux may experience muscle strain in the lungs. You can see this here, where instead of a nice relaxed vibration of the vocal folds, these muscles are squeezing very tightly over them. And that tightness is a hyperfunction that doesn't allow the vocal folds to vibrate well. And this can cause poor voice quality and tiring out. This is something that may affect people, particularly who use their voices for a living, such as teachers. Vocal nodules are a very commonly encountered problem. And you can see on the edges of the vocal folds here, these 2 little bumps. They can be very small or they can be quite large. And it's best to think of these as calluses. hindrances from the chronic overuse of the voice, just from them beating against each other over and over again. These are not nodules in the sense that you may know them from the thyroid gland or the breast or the lungs, where a nodule can be something concerning. These are entirely benign and, again, more consistent with a callus. And they don't allow the vocal folds to vibrate well. They cause you to lose air when making sound, and you can have a raspy and breathy voice. Or singers, for example, may have some difficulty reaching their head voice when they try to sing. This is a more clear picture of what's wrong. You can see a bright red vocal cord here has had some bleeding into it. And this is something that can happen very rapidly. Typically, people who complain of this were at some setting where they were using their voice very loudly. I've had many Miami Heat fans who come in after being at a game and they were using their voices. And it's something that happened instantaneously, usually from screaming, loud singing, or coughing. And that blood in the vocal cord doesn't allow it to vibrate well and can affect the voice. And then finally, a paralyzed vocal cord happens when one side is completely unable to move. And this can happen for a number of reasons, sometimes from different kinds of surgeries, different kinds of cancers. And what happens is that this vocal fold is completely unable to move. And the person who's trying to speak here is barely able to get more than a whisper out because so much air is being lost every time they try to speak. And this can cause significant difficulty, not just with the voice, but also with swallowing, as well as with coughing. Then I want to finally talk to you a little bit about cancerous voice problems. That's one of the biggest reasons why people come in if they have a voice problem, is the concern, do I have throat cancer? And I will tell you that vocal fold cancer, thankfully, is not that common. It is more common in people who are smokers or drinkers. And it's something that typically happens progressively over several months. This is something that can be treated either with surgery or radiation. You can see this bumpy look on the vocal cord here, or in this case, there's this bumpy area down here as well. Vocal fold cancer typically has excellent outcomes, either with surgery or with radiation. The surgery is accomplished as an outpatient, and I will show that to you later in this presentation. So I'm going to turn things back over to Dr. Lloyd at this point.
Okay, thank you, Dr. Rosow. You can go to the next slide. So in terms of healing the voice, we always want to try to start with the least invasive option. So Dr. Rosow is not going to jump to surgery unless he thinks it's going to be absolutely necessary. We see a lot of our patients for what's called voice therapy. And voice therapy, we often describe it as what's called like physical therapy for the voice. We implement lots of different strategies in order to align how the person breathes, how they use their muscles, and how they shape the sound above their vocal folds. So for example, I'll give you some examples that you can try right now on your own, just to experience what it feels like to do a little voice therapy. We do what's called semi-occluded vocal tract exercises. So I want everyone to take a breath in, and I want you to hold out a W sound, kind of puff out your cheeks like this. I'll demonstrate. Okay, everybody try that on your own. Thank you, Dr. Rosow. I can see him, he's doing it. Okay, do it one more time, and I want you to think about what you're feeling as you're doing this exercise. So what you're probably doing without realizing it is you're taking a breath in before you make the sound. You're shaping the sound in a certain way. You're exhaling and making a vibration of your vocal folds. And if you pay attention, you're actually probably feeling a little vibration sensation inside of your mouth, right? That is the vibration of the vocal folds that's sending those sound wave and air pulses up into the mouth. And we sense that as vibration. One of the ways that we try to instill in our patients is using an efficient way of using your voice. And that's taking away muscle tension and strain from the throat so that we can notice that vibration sensation more towards the lips and the mouth. Let's go to the next slide. Now, there are lots of different ways that we interact with people in voice therapy. We can use lots of different props like pianos and tubes that we blow into, straws, even little kazoos. You all remember kazoos from your childhood, probably. We also, you can see in this picture here, this is our Estefan voice studio that we recently opened. There's an exercise ball there. You see a piano there. You see some other musical instruments. You see a big mirror. So we use the mirror for biofeedback so we can see ourselves as we're making sound. Because one of the biggest helpful things is to actually look at ourselves and see what we're doing from a musculoskeletal standpoint, because that can affect the voice as well. We follow the principles of exercise physiology, similar to physical therapy, so intensity, frequency, overload, specificity, and reversibility. And that's how we eventually help to make things more automatic, and when we're making changes in how we're producing our voice. Our voice is like a musical instrument in the sense that we can produce it in different ways. We just have to get used to producing it in that particular way. We also call people who use their voice professionally vocal athletes, because the way in which we use our voice can be very athletic at times. So we want to train like an athlete would for the voice. Okay, I think we can move on now.
So obviously, our first preference is to treat things non-surgically and conservatively, but sometimes those treatments aren't able to get somebody to where they need to be to use their voice for quality of life, for work, or other reasons. And for that, we then institute some kind of surgical management. Now, people may be sort of nervous about the concept of voice surgery. Most voice surgery is minimally invasive. It's endoscopic. If it's done in the operating room, it's an outpatient basis. These are usually done within 30 to 60 minutes. Some specific cases, and I'll show you some of those, can actually be done in the office rather than in the operating room. And those are done under local anesthesia in just 5 to 10 minutes. And some of those treatments are only available in South Florida here at UHealth. The recovery from voice surgery is often not difficult. There's typically some voice rest afterwards, but there aren't any changes to the diet. I've had patients ask me for years whether they need to be on a liquid diet, and I'm happy to say that you do not need to be on a liquid diet. And I'm going to go through some of the different kinds of voice surgery that we can do. So I mentioned earlier vocal cord cancer. This is an example of somebody who had a vocal cord cancer that was removed in one sitting in the operating room and who did very well afterwards. Breathe. Good. So you can see there's that irregular growth on the edge of the vocal fold here. This is in the operating room under a microscope. So the patient is completely asleep under general anesthesia, and I'm manipulating the vocal fold. And I'm using a specialized laser which allows me to cut through the tumor and completely vaporize it so I can get down to the level of normal vocal cord. The idea here is that we obviously want to remove cancer and get it cured, but we also want to preserve as much function as possible. So this allows me to be extremely precise and only remove the tumor. And you can see on the follow-up, look, it's on this side. The patient's able to generate a very strong voice, and he has in fact been cancer-free for over 10 years. Now, a more straightforward surgery is for something benign like a vocal fold polyp. And this is something that we very commonly encounter. I think today in my clinic, I saw 3 different patients who had this diagnosis. And you can see it's this little rounded growth on the vocal fold associated with these blood vessels. Typically what's happened is that a blood vessel has ruptured and caused the body to form this little polyp as a way of healing. And so what I'm doing is using these very delicate micro instruments under a microscope. And again, this is probably only 2 millimeters in size. And this microscope allows me to have the precision to peel this off of the vocal fold in a way that I can spare all of the normal tissue of the vocal fold and only remove the polyp. And you can see it's coming out of its pocket very nicely there. And I'm just doing a couple of more cuts. And this entire surgery only took about 2 minutes. Obviously, it takes a little more time to get somebody asleep under general anesthesia, but the surgery itself was done. And now you can see that once we've suctioned away a little bit of the saliva and blood, the edge of the vocal fold is nice and smooth and straight. So this patient was able to generate a very good voice. Sometimes we can do these surgeries in the office, again, under local anesthesia. So this was a patient, he was a cantor at a temple, had this small polyp that was affecting his ability to sing. What you can see here is I'm using this laser fiber to shine light onto the polyp and cause it to vaporize. You can see it turning white and eventually black, and then I'm able to peel it off of the surface of the vocal fold. And this entire process takes 5 minutes. And for people who work and may not want to spend an entire day in an operating room at the hospital, this is a very attractive option. You can see 1 month later, the polyp is entirely gone and his voice is smooth and clear. So I'm going to just show you how that's done in the office. You can see that I'm using this fiber through a scope, and this patient has a polyp that you can see up here on the screen, and I'm shining the light at it, and this is the fiber that is connected to the laser. And so it's overall a much more pleasant experience in some ways than going to the hospital and having to go under general anesthesia. After a period of only 1 hour, patients can eat and drink normally, and you can see that after doing this procedure, this patient's polyp is completely gone from the vocal fold. We're also able to perform a number of injections into the vocal folds. I had mentioned vocal fold paralysis as being an issue. And you can see that what I'm doing here is I'm passing a needle through this patient's neck, and it's going into her throat. And what you're going to see in a moment is the needle up on my screen. We have very good visualization of this needle. And what I'm doing is injecting a filler material into the vocal fold because this vocal fold is not moving. And so you're going to see this needle right here on the side, this little thin needle is passing into the vocal fold, and it's going to slowly inflate. And instead of this curved concave appearance here, it's going to start bulging out. And with that fullness, it's going to be able to contact the other vocal fold and give this patient a much better voice. This is a procedure that, again, is most commonly in the community done in an operating room setting, but at UHealth, we can do this in the office in about 5 minutes. You can already see the pronounced difference in the size of that vocal fold.
So you can really appreciate the approach that it takes to evaluate and to treat people with voice disorders. And at the University of Miami, we have a multidisciplinary team approach. If you go to the next slide, you can see some fun pictures of us. Oh, not yet. You will in just a moment. So there is definitely a combination of artistic and medical. Go to the next one. There we go. Mad scientist together that we use in order to evaluate and treat these patients with voice problems. And you go to the next slide now. There we go. On the bottom left, this is our opening of our voice studio. And you can see there we have 4 voice pathologists and 2 laryngologists that we use and we see and evaluate patients together. And on the upper right-hand side there, you can see our extended voice care team, which is our professors from the Frost School of Music that we use to send our singers and professional voice users to after they are done with our medical rehabilitation and medical treatment. And we enjoy doing a lot of different outreach presentations and research with them and helping professional voice users. So it takes a village. All right.
Thank you. Thank you both so much. As a trained professional broadcaster, I certainly appreciate everything I've heard tonight because it really is very useful to our community. So as I told everyone, you have plenty of time to still enter your questions using the Q&A feature on your Zoom screen, but let's begin with one question that had already been submitted in advance. After an exploratory operation to extract samples from a ganglion in her neck, my wife had a paralyzed vocal cord. Is there anything that can be done to make that vocal cord work again? And I think some of the things we've seen certainly do attest to that. So I believe Dr. Rosow.
A very timely question, and something that we see quite a lot of. And your experience, if you are watching, is not that different. We have many patients who go through this sort of situation. Many different kinds of neck surgery can result in a paralyzed vocal fold, whether it's thyroid surgery, a ganglion cyst like your wife experienced, spine surgery, carotid artery surgery, a whole host of different things. The nerve that moves the vocal fold is, unfortunately, it's a very, it doesn't take a joke very well. And any sort of inflammation or injury that damages that nerve can sometimes be irreversible. Many cases do reverse and come back on their own, but sometimes they do not. And if they don't, if the vocal fold remains paralyzed, as I demonstrated to you, we do have very good treatments for vocal fold paralysis to restore the voice, whether it be an injection that can be done in the office. We even have, in some significant cases, or people with very severe paralysis, we have surgeries where an implant can be put in on a permanent basis to push the vocal fold into a better position and restore the voice.
Okay. You showed some images of throat cancer and the removal of those tumors, etc. This question is, explain the first symptoms of throat cancer.
Yeah, a very important question. So throat cancer can be in many different sites. You know, we're talking today about voice and vocal cords, but the throat obviously is a larger structure that extends from the back of your tongue all the way down to the larynx and to the esophagus. But in particular with the vocal cords, an early throat cancer can present with a change in the voice. And even something as small as 1 or 2 millimeters on the vocal fold is perceived as a change in the voice. And I've had many patients who said there's just something different about my voice. And sure enough, they may have had a very small cancer. That's why we recommend, if you have any changes to your voice that last longer than 2 or 3 weeks, we recommend having your vocal folds evaluated by an ear, nose, and throat specialist, whether it's by myself or somebody else, but the vocal folds should be looked at. Other symptoms of throat cancer can include difficulty swallowing, sometimes difficulty with breathing in some advanced cases, and a lump in the neck is also something to look out for. So if you notice that you have maybe a lymph node or some other growth in the neck and it's not going away, again, after a couple of weeks, you should have it evaluated.
Okay. Here's a question that I think is interesting for anyone who's had surgery. How can you correct voice problems caused by intubation? As we all know, that's a tube inserted down the throat during surgery.
So that's definitely something that we're experiencing a lot of during this pandemic. A lot of people have been intubated because of COVID. But of course, people are intubated all the time for elective surgeries or for emergency surgeries. And intubation is typically a very safe process. It's putting a breathing tube down the throat. But in order to put the breathing tube down the throat, it has to pass by the vocal folds. And sometimes if the tube is too large, or perhaps if somebody has very difficult anatomy and it's a very difficult procedure, the tube can cause injury to the vocal folds. Some of those injuries are correctable. In some cases, it may cause a temporary ulceration of one area. But I have definitely seen some cases that can cause permanent scarring of the vocal folds. And that's really why, again, it is important to have the vocal folds evaluated and pictured, because until you've seen them, you don't know what the problem is and how to effectively treat it.
And Dr. Lloyd, I'd like you to jump in here too, both of you, for this next question. I had hypopharyngeal cancer 12 years ago and have started experiencing many latent side effects, including dysphagia and swallowing difficulties with aspiration issues. My voice is very faint and hoarse, and I'd love to know how to restore it if possible.
Sure, yeah. So when someone experiences, they had radiation, they said, right?
Yeah, apparently.
Yeah.
For the
Right. So radiation sometimes does have progressive effects over time that can cause stiffness of the muscles, tissues inside the throat. And that can certainly lead to things like difficulty swallowing liquids and solids and pills and whatnot. And also over time, the vocal folds can become stiff, irritated as well. and not vibrate as well. I think the first thing that someone would need to do is have an evaluation. We need to be able to visualize the vocal folds to be able to see what's going on and how they're closing and how they're vibrating. There are things that can be done in certain instances. There could be compensatory tension associated with changes in anatomy as well. And sometimes that can be helpful to do some voice therapy. Regarding the swallowing, there are specialized swallow studies that can be done. Primarily at the University of Miami, we do what's called a modified barium swallow study in the X-ray department, radiology department, where we give you different types of foods and liquids to swallow, and we watch it go from your mouth all the way down into your esophagus. And that gives us an idea as to what kind of function you're having with your swallowing, so we can make recommendations on how to hopefully help you improve it or modify your diet if necessary.
Dr. Rosow, would you like to weigh in on that?
I definitely agree with everything Dr. Lloyd just said. Again, not to beat the same drum, but someone who has a faint and weak voice and is having issues with swallowing and aspirating food into the airway. Again, visualization is really key, because one of the long-term side effects of radiation can be vocal fold paralysis. We've definitely seen that, and it can be something that appears even 20 years after radiation. And it's one of those, poorly understood side effects that can happen. But what we think is that the radiation eventually causes some long-term damage to the nerve and it stops moving. And again, if that is the problem, then we do at least have some ways to potentially rehabilitate that paralyzed vocal fold and try to improve the functioning.
And I appreciate what both of you have said in terms of, people have to look closer. This is not a telehealth conference we're having. Obviously, these are things that need to be looked at. And that's why our contact information at the end and at the beginning will tell people how to reach out to all of you to see if they can get help. Here's a question on someone who has ALS and has a hoarse voice and says getting worse. What can be done?
First, my condolences. That's a very difficult diagnosis to live with, and so I know that's a lot to be going through. ALS, or Lou Gehrig's disease, is a very challenging, progressive weakness of the muscles in the body. It's a neuromuscular disease. It is progressive and unfortunately has no known cure. Part of that process, as the muscles weaken, one of the muscles that becomes weaker is the diaphragm. And so that actually makes the breathing become more shallow and a little bit more labored. The vocal folds themselves can weaken, and indeed most of the muscles in the throat and in the rest of the body can over time lose some of their strength and tone. And just like any other muscular system, if the muscles are weakened, they're not going to function as well. And so bringing the vocal folds together so that they can vibrate well is going to become more challenging in somebody who has ALS, just because that weakness is going to be very difficult to overcome. In terms of how to make the voice better, again, that is definitely challenging because of the progressive nature of it. We have certainly partnered with our ALS patients and try doing some therapy, but we don't want to overtax these muscles that are weakening. And I think Dr. Lloyd can talk a little bit about some of the ways that we can at least augment the communication for these patients.
Yeah, we have amazing technology available to us. And at the University of Miami, we actually have a multidisciplinary ALS clinic, and we have speech pathologists in that clinic with neurologists and nutritionists and physical therapists and a whole host of different specialists. And one of the ways that we help people to continue to communicate is by using assistive technology. And you can even, if you're earlier on and still have a little bit of voice production available to you, you can actually record yourself and input that into a computer so that later, if you're having more difficulty using your voice, people will still be able to hear your voice. So there's a lot of different options available, from something that's very low tech to something that's very high tech with a lot of technological assistance. So if you're interested in learning more about that, I would encourage you to reach out to the ALS clinic at the University of Miami. Miami.
This has been in the news actually recently. The actor Val Kilmer recently banked his voice and has been able to use that to communicate since he has had some issues with throat cancer. And the film critic Roger Ebert, before he died, he had also banked his voice. And so it can be a very effective option for communication.
I know, Dr. Rosow, that you presented about the vocal cord paralysis and the surgical treatments, and this person specifically says that they have bilateral vocal cord paralysis since 2007. So maybe you just want to go over it a little bit more detail again. I know you showed all the visuals, so that was very helpful to see.
Of course. And actually, bilateral vocal fold paralysis is a much more challenging problem to treat. When I showed the video of one side being paralyzed, one is still able to open and close well. If both of your vocal folds are paralyzed, then they're not opening when you try to breathe. And so instead of having a nice wide open airway, it's like trying to breathe through a small slit or through a coffee straw. In some cases, I have many patients with this disorder, and it can be very uncomfortable. I mean, imagine breathing through something the size of a coffee stirrer straw from Starbucks. Unfortunately, the treatments for this can be challenging because anytime we try to do a surgery to enhance the function for somebody with both vocal folds paralyzed, it's going to take away from something else. I like to tell patients it's like looking at a seesaw. And on one side of the seesaw or on the scales, you've got your voice. And on the other side, you have your airway. And any surgery that I do to improve your airway is going to worsen the voice, and vice versa. And unfortunately, there aren't good treatments at this time that enhance both. And so we find ourselves making a compromise and trying to figure out what can we do to take just enough voice away to give you just enough breathing. And it can be extremely challenging. But we do have surgeries to remove some of the tissue from the vocal folds and allow more space for breathing. If we want to enhance the voice, that's where things get more challenging because we don't want to make the breathing so poor that someone's unable to function.
Well, for all those out there who have had COVID, here's a questioner that says, I've had hoarseness since I got COVID last August. I guess that makes sense. It's an upper respiratory virus disease. Is it common? Is it happening a lot? Are you seeing it?
We're definitely seeing quite a bit of it. We see a lot of people with long COVID. We see people who've had recent COVID. There's a whole variety of side effects that people can experience from this. It's important to remember that, before it was a pandemic, COVID is a coronavirus very similar to the virus that causes the common cold. And so some of the side effects of COVID in some ways are similar to what we can see after common cold. And that can just include inflammation, sometimes a chronic coughing that doesn't go away. Obviously, with COVID and with people who can be very sick from it, there can be other side effects such as difficulty with breathing. If the lungs have been damaged by COVID, again, that disables the ability to generate a strong voice. It can make the voice weaker because it's more difficult to breathe. And of course, anybody who's been hospitalized or in an intensive care unit with a breathing tube is at risk for having injury to the vocal folds from that.
Okay. Some of the questions coming over are asking whether this presentation is available to them afterwards. Yes, the answer is going to be available on the UHealth YouTube channel. We'll give you information. I believe there's follow-up emails that come to all the registrants so they can get that information. Now, here's another question, again, talking about sort of it could be so many things, but this person says, I have phlegm buildup constantly, especially in the morning. It's affecting my voice when I make presentations. I get a tickle, I start coughing, and my throat is sore every day. What's the deal? Could it be a variety of things?
I can start with this one, Dr. Rosow. So yes, we hear this a lot in clinic. And you are absolutely right. A lot of phlegm sensation in the throat can come from a lot of different reasons. It can come from uncontrolled allergies, sinus issues that drip down and irritate the throat. It can come from things coming up from the stomach, like reflux. It can come up and irritate the tissues of the throat. It can even come from people who don't drink enough water and are not hydrated, and that can cause thick secretions. It can come from people who have laryngitis like me right now, and I'm constantly clearing my throat as a result of that. And one of the more interesting concepts that we sometimes will explain to our patients is that, for example, if you've had a cold and you've coughed and cleared your throat a lot, you kind of get used to that behavior of coughing and clearing your throat. And that actually irritates the vocal cords. And that irritation is going to cause the mucus to come there and sort of gather to lubricate and protect it. And you're going to get into this vicious cycle. So that sort of coughing begets coughing because it has that it brings the mucus to that area as well. So we have to kind of look at it from different perspectives. So it's hard to tell just by knowing this one symptom, but there are a lot of different causes for mucus to form.
Right.
My addition would just be that some phlegm is actually normal. I know that may not seem like, it may sound heretical to say that, but phlegm is just mucus. And mucus is actually something your body naturally produces. It's something that's produced by all of the surfaces of your respiratory system, from your nose down to your lungs. And the mucus is produced typically in response to inflammation, and your body makes more of it. But mucus is also just produced to protect the lining of the breathing system and to carry away dust and other particles that the body doesn't want. And typically you swallow it, and that's all you know about it. If you have excess mucus, now that can start to feel like it builds up in your throat, and then you cough it and clear it, and it's uncomfortable. And as Dr. Lloyd said, it can come from a variety of sources of inflammation, whether it's allergies or acid reflux or a sinus infection. And again, that's why being evaluated if you're having chronic excess is important, just to make sure that you don't have something that's producing it. Typically, it's from something benign.
Mm-hmm. And so typical allergy season, you hear so many friends who say, oh my gosh, I'm suffering. The wind is blowing everything around and I'm just really dying, and they're taking all the medicines to try. So that could be as innocuous and benign as that. It's just
absolutely.
Okay. Here's a question that I think is may be very typical of teachers. I'm a teacher and I don't know how to control my voice. Many times I go home with a sore throat and hoarseness. I don't know how much they're screaming at the children in the classroom, perhaps. But what vocal exercises can I do to avoid this? Or how can I perhaps healthily use my voice?
I think one of the first things that we will work on with teachers, or any kind of professional voice user, because teachers are definitely professional voice users and vocal athletes, is awareness, improving your awareness of how you're using your voice. So often that when we're in loud background noise or we're distracted, we're using our voice in a way that is what we call hyperfunctional or phonotraumatic, and can irritate the tissues of the vocal folds. So understanding how much effort you're using when you're using your voice is very helpful. Now, we often recommend teachers use things like amplification in their classroom when they're teaching, no matter if they think they need it or not. It's something that's just going to help them not over project and use their voice too much. We'll give them vocal warm-up exercises, and that just it depends on what type of problems that they're having. Could be something as simple as like the W sound that we were doing before, or a hum sound, or a series of glides to warm up the voice. But I think probably the number one thing we have to improve upon is our awareness of how we're using our voice in that moment in time, and try to use it with the least amount of effort as possible.
Mm-hmm. This question is very specific. This is someone who says they have terrible hoarseness and went to a throat specialist who told them they had a slit in the back of their throat. Sent me for throat therapy, which she says was a total waste. And she's anxious to hear your thoughts on this slit in the back of the throat.
Well, it's a little difficult to know exactly what the slit is. It could be referring to the closure of the vocal folds. If you'll remember when I showed you the videos of how vocal folds come together, you want them to come together completely without any gaps, because the more gaps that you have, the more air is lost when you try to speak. So instead of a nice clear voice, the voice starts to get more breathy like this. Now I'm exaggerating a little bit, but it depends on the extent of how large the gap is. If the slit that you're referring to in the back of the throat maybe was somewhere between the vocal folds, then that could indicate that they're not coming together entirely. And there can be different reasons for that. That can be because of scarring of the vocal folds. It could be, in some cases, due to aging. There can be some atrophy of the muscles of the vocal folds over time. Or again, it could be from a partial weakness of one side. That's where, again, the really careful evaluation of how the vocal folds move and come together is so critical, because it really changes the kind of treatment plan that we recommend. Therapy can certainly be very helpful in some cases, but in other cases, it may not be able to overcome a large gap between the two vocal folds, and someone might need an injection before therapy can be helpful.
I think that I saw in the presentation how you talked about how GERD or acid reflux or any of that can cause throat cancer. I think people are concerned about how high is the risk of throat cancer resulting from this. I know you also said from drinking and smoking, obviously from smoking, clearly, but talk to us about how high that risk is.
Well, let me clarify that the good news is that there isn't any evidence that acid reflux causes throat cancer in the larynx or anywhere from in the mouth and throat. The one area, if you want to call it the throat, that can be affected by acid reflux in terms of cancer is the esophagus, which is the tube that brings food down to the stomach. And if the esophagus is chronically exposed to acid reflux over a period of time, then you are at higher risk of developing esophageal cancer. But as far as we know, there really isn't any compelling evidence that laryngeal cancer or throat cancer is caused by acid reflux. It is certainly caused by the things that you mentioned, by smoking, drinking. Exposure to radiation can do it, especially for people who were alive in the 50s and may have received radiation for acne, for example, which thankfully is now no longer being done. Also, exposure to certain kinds of pesticides or other things that can be inhaled. Those can increase the risk of throat cancer as well.
Are there any genetic components to voice disorders that we know of, that there's research or study that says if your parents or grandparents, anything like that?
So obviously for certain kinds of cancer, that's a yes. There definitely are genetic predispositions to cancer, although thankfully for throat cancer, that's less so. We don't really know of any genetic predisposition to benign voice disorders. There are certain kinds of neurological disorders that can cause some tremors or strains of the vocal folds that may be genetic in nature. But obviously, your vocal signature is in some ways a product of your environment. In other words, you often talk the way that you're taught to. And so if you grow up in a household where people are yelling and screaming all the time, you may grow up to yell and scream all the time. And Lord knows in Miami, we have a lot of that. And so that kind of voice use can certainly lead to problems down the road.
Yes, for sure. I was a cheerleader in high school. I can relate to that. So, we're coming to the end, and I would love for both of you to give us some wrap up conclusions, some statements that tell us the importance of this wonderful instrument of ours, our vocal cords, and of protecting it and making sure it's healthy. We'll start with Dr. Lloyd.
Sure. Thank you so much. So I think, like I mentioned before, listening to your body, when something is wrong, and if something is wrong for longer than a couple of weeks, it's time to come get checked out. It could be something simple, something that's really easy to improve upon, drinking more water, for example, or it could be something that you might need a short course of voice therapy for, or you might need a small surgery with Dr. Rosow in the office. But it's important to, take care of yourself in general, eating a good diet, drinking plenty of water, and sleeping. I don't sleep enough, so maybe that's why my voice is hoarse now. But I think all of those things tie in together and affect the health of our voice, just like the rest of our bodies.
Mhm. And Dr. Rosow, any concluding statements?
I'd certainly like to echo Dr. Lloyd's statement about, making sure that listening to your body and having something evaluated is important. I think I see a lot of patients who maybe ignore the fact that they're having a voice problem, and they can ignore it for a period of years. And at which point, if they had a very small tumor, it may have grown into a much larger cancer. And I certainly don't want that for anybody. So that's why it's so important to at least get something checked if it's going on for more than a few weeks. I'd also like to say, I think it's very important when you do make a decision, if you do have something that requires surgery or a procedure, please be picky about who does your surgery. And again, it doesn't have to be me, but whoever it is that's going to do it is going to be operating on your vocal folds. And if you take too much tissue away from the vocal folds, if you do something to scar them, unfortunately, they don't grow back. And we've seen that with a number of people, a number of very public figures like Julie Andrews, for example, who had a botched surgery over 20 years ago and has never been able to sing the same way. So it's very important when you decide to have surgery that make sure it's somebody who does it regularly and doesn't just do it a couple of times a year, and that they know how to protect your voice, because it is such a crucial part of your daily life, whether it's work or socializing or being with your family. And, when you lose that ability to communicate, it can really impact your quality of life.
And of course, you're in academic medicine, and the last thing you all do is toot your own horn. But you did make some statements about how the program at UHealth, a multidisciplinary care team approach, has tools that perhaps other centers in South Florida don't. So tell us some specific things that we do at UHealth that perhaps you can't find elsewhere.
So I showed you the footage of the laser in the office. That's something that almost nobody else has. And we were certainly the first ones I think in the entire state of Florida to have that. But we've been offering that to patients for over 10 years, as well as a whole host of different procedures that can be done in the office. That's something I think that is very difficult to get anywhere else.
That's good to know. And Dr. Lloyd, is that therapy, the Estefan Voice Center and all that, is that typical? Is that common across the board in other medical centers?
Certainly not. And we are very grateful for the generous support of the Estefans. But I think that one of the things that's not typical, and speech pathology, I'm a speech language pathologist, but I specialize in voice problems. And it is atypical to find a speech pathologist that specializes in voice problems. If someone looks up their insurance, say, oh, my doctor told me to go see a speech pathologist, they look up on their insurance who is available in their network or easily in their town, chances are you're not going to run into a voice specialized speech pathologist very easily. So it's important to know where these people are, and oftentimes they can be found in academic medicine and bigger centers like that. And so it's important that when you have a voice related problem and require things like skilled voice therapy, that you're working with a speech pathologist that has expertise in voice care.
Yes, absolutely. No, these points are very well taken. And we have come to the end, and we want to thank you so very much. Dr. Rosow, Dr. Lloyd, please have some herbal tea and take care of your voice. But your knowledge and insights were invaluable, and thank you for your generosity in sharing them. And to all of you, our participants, for being interactive and taking part with your smart questions and excellent interaction. We at the University of Miami want to remind you that you can visit umvoice.org for more information. There's our Instagram at umvoice, so follow us. You can also call 305-243-3564 for more information or to make an appointment with our experts. We certainly hope that you've learned something tonight. We all certainly have. And please complete the survey at the end to provide more feedback and to give us topics that you might be interested in. And yes, you're going to get a video of this on our YouTube. We'll be in touch. Thank you so much, both of you are experts. Bravo, and everyone out there, be safe. Have a great night.